There is one Diamond King, Dr. Saujibhai Dholake also there in Surat. He's just 4 chopdi pass and having, lots of CA and other people under him. So white glow after phaco emulsification is my today's talk video. So this is the patient, almost Morganian cataract patient came to me for the phaco surgery. Everything was routine till now. CCC was wonderfully done. There was nothing wrong and nothing difficult to do and difficult to go ahead. I was not anticipating anything else in this patient, and when I did my first job, I found there is a white epinucleus plate, very thick, might be very thick plate behind the nucleus, and everything went smoothly. Phacoemulsification was very well done, and there was no complication or there was no any difficulty till this step. Once the phacoemulsification is completed, the last piece I have emulsified very well, and there was till this stage there was no my BP was normal. But at this stage, I started trying to catch the epinucleus. And you can see, I'm not, this was my first attempt to catch the epinucleus. It is not coming out. So this was first case in my life in my 35 year of career. I have never seen white glow, such white glow in any patient. So I thought I'll be able to pick up this epinucleus plaque with the help of my bimanual irrigation and aspiration. So this is my second attempt to find out where the epinucleus is there. I'm trying to catch the epinucleus, but I cannot, you know. So my second attempt to catch the epinucleus failed, and now I'm trying my third attempt to catch the epinucleus, and my third attempt also failed. So I was not finding out where the epinucleus is there. White glow is there, and this video is edited, so it is going very fast. But during each step, I was very much confused, and I was very much dilemma. What should I do, and what should I not do? So because there was no reference, in my personal experience, there was not a such case I have come across, and this has become a totally blind procedure afterwards. So my fourth attempt was no, it was useless. Now it is my fifth attempt. I'm trying to disclose the epinucleus and to find where the epinucleus is. And I thought whole lens matter might have gone into the posterior segment. So I implanted the lens, and I mean, before that, I thought if it is there, if epinucleus is there somewhere in the fornix, I'll be able to remove it after implanting the IOL. So my sixth attempt, seventh attempt, seven, eight, ninth attempt, even I was not able to find the epinucleus anywhere into the anterior chamber. A lens is very well implanted. It was totally blind procedure. There is no red glow. There was no reference of posterior capsule. I'm trying again and again to find where the epinucleus, where that lens matter is lying in the all anterior chamber. So I tried to rotate the IOL, disclose the cortex, disclose the epinucleus, white chunk of the epinucleus. I again went behind the IOL, so anywhere if it is hidden, I can find it out. But unfortunately, there was no epinucleus, there was no any lens matter which I could found into the anterior chamber. So all my attempt to get the epinucleus out was vain, and there was no any reference. I know I some lens matter does go behind the posterior capsule, but in this case all nucleus and other than nucleus was not there into the anterior chamber. So all my efforts are totally wasted, and in next once this case is over, I gave up. I thought there is no epinucleus at all into the antechamber, and I should stop and let me think what should I do afterwards. So I finished the case, and in next slide I will see. So I finished the case, and I thought Pradeseva Devase. Okay, so uh, so this is first day post-operative case. post operative. There is total white glow. There is total white glow. Nothing is seen behind the posterior capsule. Posterior capsule was also not seen very well, and patient's vision was improved from hand movement to some counting finger, maybe 1 or 2 meter. I don't exactly remember. And I I thought to take the opinion of my veteranal friend, Dr. Ashish Kodifadi, is regularly visiting my place. And he saw this patient and he said, "Me, sir, I have even never seen that total lens matter is going behind the posterior capsule and sitting into the vitreous body." So he advised me to go for bimanual vitrectomy, total vitrectomy, and clear out the vitreous and to get. So we four people were trying to find out what is the solution. Myself, my vitreoretinal friend, patient himself, and patient's son. All four people were confused from where we will be able to give the vision to the patient. But my patient and relative of the patient was so confident and were so faith in me. They opted to wait for little bit because I am also little bit hopeful I might get something out of this thing. So this is the first week post-operative. Little lens matter was absorbed from the vitreous. So we were confirmed that all lens matter is there inside the vitreous, and this is the first week post-operative. Vision was also little bit improved, and this is first day versus first week post-op. So this is on your this is first day and this is first week. So lens matter started little absorbing. And my patient also cooperated me, relatives also cooperated me, and at the end of 1 month, total lens matter was gone. So every fraction of second, you were in dilemma. My 8 or 9 attempt to remove the epicortex was failed. First week, my patient cooperated. Then at the end of 1 month, when patient came, it was totally clear. Patient vision was 6:6. For 1 month, we gave the patient oral steroid and anti-glaucoma medication. And how could I achieve this? Believe me, we have we have two options at any moment, either to be in parasympathetic tone or to be in sympathetic tone. Sympathetic tone is something which has given God to us, which has given nature to us to get fight or flight mode. Uh, Whenever we are in fight or flight mode, we are never calm, cool, comfortable. We are always under conflict. But once our fight and flight mode is gone, we should be in parasympathetic tone. And there are always two answers you get from your own mind, your own thoughts. One answer is coming from your mind, which gives you sympathetic tone, and one answer you get from your gut, what we call is gut feeling or heart feeling. So we have lost that heart and gut feeling. If you do vipassana sadhana, you will get more and more your gut feeling and heart feeling rather than your brain feeling. And I don't say believe me. Don't believe me because I say do it. Come to your own conclusion. So thank you. My talk is over. Thank you very much.
Mukesh, thank you so much. Thank you. Every time you come and you really entertain us and teach us and share your brilliant innovation and examples. But this is really a special moment, and